actually so many ways, because I understand procurement in the NHS, and I have understood some of the issues that they have in trying to work with the market. Quite specifically, some things around social value and sustainability. Those are the types of things now that are on the agenda for people working in procurement in the NHS. They've got a lot of different ways that they're supposed to be able to measure and define value. I think what it means as well is that my experience means that I'm not trying to boil the ocean around how we kind of approach addressing some of these issues with industry. There are some quick wins that we can do, and I know where some of those issues are and can address them straight away. Really, the main one is the power of collaboration. I don't think I've witnessed how well industry and the NHS work together during COVID. I have not experienced that before and probably since as well. So actually, when you see industry and the NHS trying to address a problem together and kind of really bringing together their individual power, very, very effective. So certainly that. On a more practical level, probably the power of supply chain mapping. Supply chain mapping became something that it's not really done in the NHS, it's not even really done in a lot of industry. But in terms of being able to identify where those problems are in supply chains and address that resilience, it's something that we're going to have to face into as a system, how we do that, both industry side and with the NHS. I think there can be a really powerful way, coming back to the collaboration point, to collaborate between NHS and suppliers, really putting into sunlight some of the issues that we have and looking collectively at where we can start to address those. Demystifying some of the issues and challenges that we've got, I think in many ways, both with industry and with the NHS, there can be assumptions that we can't do things because we've never done them before. Actually demystifying some of those perceived barriers and working out ways around it. This is a really good environment to be able to do that. I can't answer that question without mentioning the 10-year plan for the NHS, which we're expecting to be launched later this year. That's a burning platform. We've got a burning platform in the NHS now around making some of the changes, efficiencies to some of the well-publicised problems that we've got in the NHS, which is clearly a big opportunity for industry to be able to step up with solutions to some of those. And that's going to be around some of how do we shift care from hospital to community, how do we move from analogue to digital, some of those areas that it's now kind of that burning platform for industry to be able to step up to. Also, the Procurement Act 2023 will be being launched later this month. That's going to bring some opportunities to look at the way that we commercialise in the industry in different ways. There'll be more market engagement, more open competitive processes, which should hopefully start to change the dialogue between the NHS and suppliers. And lastly, value-based procurement. It's a long burn. I do believe that that's not something that's going to really start to change the way we do business in the NHS immediately, but it is a step towards starting to challenge the cash saving approach that has been so prevalent in the NHS as a way of measuring value and measuring efficiency.